Hi, everyone. I'm so glad to be here today for this on-demand virtual talk about a response to a request that students had in public health preparedness. My name is Jennifer Schrader Tyson. I am a full-time faculty member at Appalachian State University's Public Health Program, as well as I continue working with local health departments and most recently some arts companies on reopening. My background is in occupational health and safety originally, and transitioned my way into a maternal and child health focused public health career, and then realized that I could marry both of those fields together. So my happy place is when maternal and child health intersect with public health preparedness and emergency management. When I started working at Appalachian State University full-time in the fall, it really gave me a chance to start mentoring, connecting, getting to know students. And it was in the middle of a pandemic, right? So the conversations we were having were about what is happening on the ground? What's happening with the local health department? What has the response been like? Tell me all of it. What in the world is going on with vaccination? You know, as public health students, they do tend to dive deep into COVID-19, what it means, what the data is saying, what the research is coming out. But they also want to know on the ground and in person, right? That's often a topic in public health. How do I actually respond? How does public health on the ground look day to day? And that's what's so fascinating with this specific fellowship is it was a response to students wanting to get together and develop something. I'm going to walk you through the website really quick. I think that that's the best platform to share with everyone and make sure that that web page is available. Basically, what I ended up doing was an application process because I wanted to get a pulse on how interested students were. Did the application process and got a solid amount of interest, ended up accepting a good majority of those students who fully completed the application process to show their commitment, especially since it's the first cohort. You know, you want to make sure you have people that are really interested in doing it. So I decided to develop a Google site as a platform for everyone to connect. There's a front-facing page that's public, and then there's a back-facing page that I can invite any fellow to view. The way we set it up is the first part of the program, they do some training, and it's actually really easy contact tracing case investigation training. But interestingly enough, at the beginning of the pandemic, the majority of people in public health who were going to be doing that work didn't have that training. So this is an opportunity for students to get career-ready professional development. And the other part of the program that I outlined, I call it a mastermind. It's actually pretty common in entrepreneurship world, social entrepreneurship specifically, where a bunch of professionals get together and they have someone who is knowledgeable in a topic, and you systematically organize the sessions with other people who are interested in learning more about the topic so that you can learn off of each other. So the idea around a mastermind is you have someone that has expertise and you have a lot of people that are interested in developing that expertise. So you come together in a semi-formal structured way to build a network around that learning. So again, it's called a mastermind, and I've got a template on the website for everyone to see. Let me go ahead and share my screen so that you can get a sense of the website itself. So Google has an option for everyone to build a really easy platform, website-based sharing elements, right? So I can use this page for anyone who's interested in applying or shows an interest in meeting someone that's already going through it, wants to know a little bit more about it. You can go to the web page, read our mission, which is to explore, create, and learn with the rising public health workforce and preparedness activities. We've got a description here. We've got some scholar quotes Having such a close-knit group of peers really helps develop conversation and bring others into the conversation. The ideas from so many perspectives really have shown me what it means to be an Appalachian public health major. It's a beneficial opportunity to connect with like-minded individuals who have the same passion for creating a better community through public health. It's a great space for learning and educating further about public health preparedness. So some testimonials. I went ahead and did a partnership between App Healthcare, which is the local health department, and Appalachian State University with this fellowship, because a lot of the collaboration and a lot of reason that we are able to bring groups of people together is because of the great partnership that the local health department gives and their leadership in the response. There's also an internship that's associated with App Healthcare. This first cohort had 2 interns that were a part of the cohort to really help the students not only see it from my perspective as a public health preparedness professional, but also from people who are on the ground doing the work day to day from an internship perspective, who also happen to be students. So this is a description that I can easily share with folks. I give a timeline. This is the timeline for the upcoming 21 and 22 cohort. There'll be our second cohort. Definitely got to make space for the team itself so that people can really see who's involved. How can I contact them? Oh, maybe I know someone. And then also giving that space for fellows, because they do give a lot of their time and vulnerability to be a part of this group. And then, of course, keeping everybody up to date on what some of the activities are, which include doing presentations like this NACCHO Preparedness Summit presentation, which they, in partnership, helped submit the abstract and are helping to develop the on-demand presentation. And then this is the back-facing element of the page. Only those who have access to the website will be able to actually open it, so we can put some more personal internal things that need to be very specific to this group, right? So that we can be true to ourselves and develop effective implementation timelines, objectives that really apply to us as a group. My hope in the future is that cohorts will shape each and every fellowship based on what their interests are, with the shared interest of public health preparedness. We have our aims on this page. Say someone isn't able to make these sessions, we record the session so that everyone can have access, even if they're not able to be physically present or virtually physically present during that time. Here are the 2 contact tracing case investigation trainings that they go through in the first part of the traineeship fellowship. And then here is where they can access the mastermind platform itself. Like I said, it's a year-long commitment. The first half of the year is really focused on getting to know each other a little bit, but more so training. And then the second half of the year is when we open up that mastermind on a biweekly basis, and we come up with our session objectives. We develop a group charter, and we decide what we want each of those masterminds to look like. And then again, it's another platform to highlight the fellows that are currently enrolled and even giving them their email address so that they can connect with each other in the future. Thank you so much for listening to me today. There's going to be some B-roll that we're integrating. I'm going to give you an exact view of what one of these looks like. We had this specific cohort decided that they wanted to bring professionals into the mastermind so that they could, one, learn from that professional, but also ask them questions and develop an informal network with folks. So we're going to give you a highlight of what that looks like. And then each student that helped submit this presentation is going to give you their perspective on the fellowship, the Public Health Preparedness Fellowship at Appalachian State University. Really appreciate your time, and please feel free to reach out if you have interest in partnering. I would love to see this grow. We have a lot of formal platforms in public health, and I'd love to see the networking approach of public health preparedness amongst us become more of a regular thing.
Hi, everybody. My name is Emily Benson, and I am a Public Health Preparedness Fellow. I'm currently a junior public health major at App State, and I am interested in going into global health and epidemiology.
Hi everyone, my name is Molly Fox. I am a senior public health major and I am also one of the 2020 to 2021 Public Health Preparedness Fellows.
Hi, I'm Laura Brady. I'm a public health preparedness fellow here at Appalachian State University. My major is public health with a chemistry minor, and my interests are public health dentistry.
I applied for this fellowship because I wanted to learn more about public health preparedness and learn how to use the skills that I had been learning in my public health classes and to help respond to the coronavirus pandemic.
I heard about the fellowship last year when I was taking a class with Jennifer. I came into our office hours just to kind of talk through some opportunities, and she mentioned to me that she was coming up with this sort of mastermind where we could work together with other students and kind of just learn, have a platform to learn from each other about public health response preparedness, specifically related to COVID. So it sounded like a really cool opportunity. So from then on, I was on the lookout for the application and I applied the second that it came out.
So through this fellowship, I was able to see public health applied through guest speakers, connect with my peers on a different level that I had I not been given this opportunity, I wouldn't have been able to connect to those guest speakers or my faculty or my other peers in the way that we were able to, especially being such a close-knit group. It opened up more room for conversation.
So this fellowship is all about learning not only public health response preparedness in terms of COVID, but also just in general. So I thought what was really cool is it started off where we were mainly focusing on the competencies needed to respond to the COVID-19 pandemic. So through that, we did case investigation and contact tracing trainings, and we were able to really talk about what is happening in real time in the field of those working on the front lines to help mitigate COVID. That was so cool, and it was really interesting to learn all of the things that go into emergency response preparedness and how all of the skills can translate into a pandemic, all of the skills needed to respond to any disaster. And that was really unique and interesting. And what I like so much about this platform is we were kind of able to mold it into what we're looking for. So I would say we almost made a shift from just learning about COVID response preparedness to pretty much every type of response preparedness. We were able to talk to the emergency director here at App and just learn about his job in emergency response preparedness on a college campus, which was really cool to see how those competencies kind of translate just in the day-to-day. And we're even able to bring a speaker in who works as a dentist and see how she works in public health preparedness in the field of dentistry, which is something that I didn't even make a connection to before this. So this fellowship was really all about having conversations and being able to ask questions around what goes into responding to disasters and emergencies and just the day-to-day of public health.
In this fellowship, we have learned about what public health preparedness is. We have done contact tracing trainings. We've heard from other public health professionals in the field about their job, their responsibilities, and public health programs that they have been able to help implement. And we've also collaborated with each other and discussed public health problems going on in the world right now.
I would say what's been the most valuable throughout this fellowship has been being able to take what we're learning in our biweekly meetings and through the people that we've learned from and being able to apply it to the real world. So I think what I've learned actually even about myself is that I learn really well when I'm able to translate competencies into the everyday world and see what I could do with it to make an impact and to move forward. So even with the case investigation and contact training portion of this fellowship, we're able to take those ideas and competencies that we've learned and get a job with that in the future. So we're getting this amazing training, and then we're being presented with jobs where we could go and work to help with COVID response.
The most valuable part of this fellowship has been the guest speakers that have come to share their personal experiences as public health professionals with us. Personally, I learn a lot through hearing the experiences of others, so getting to hear from and talk with the individuals who have experience in the field has allowed me to become more prepared to go confidently into the field of public health in the future.
Okay, so for me, the most valuable thing is having such a strong support system, especially in COVID-19 and just everything that's happening in public health. It's nice to have those people to talk to and understand what's really going on in the real world. For future and application, I know that the peers, faculty, community members I've been able to connect with will allow me to connect deeper later in life with no matter what I end up doing. So because I can take those conversations that we've had and really grow and learn from them later in life. And right now, I can already tell a difference in being able to have a group to connect with at such an intimate level. It's really showed me how when I get out into the real world, out of school, I'm on my own, like maybe even I could do something like this where I am.
In the future, I hope to go to grad school for global health epidemiology and work to reduce inequities that exist among impoverished communities in the world. I can apply what I have learned in this fellowship through being further prepared to respond to any public health emergencies that might occur as I'm working in the field, and I can also better understand how to communicate effectively with the partners.
I would say another thing that's been really valuable has been the network that we've been able to build in this fellowship, just with the other fellows and with Jennifer. I feel so lucky that I've had a group of like-minded individuals that I've been able to collaborate with and receive advice and mentorship from this past year. Especially with COVID, it's been really nice to have a support network where I can come to them and ask questions and get advice, and we can talk about all things public health, and we all have a lot of the same interests, but a lot of other interests. And I've been able to get new ideas and gain new insight in the field of public health through them. I would say, aside from all of the great things I've been able to learn, I am really thankful and really value the connections I've made through this fellowship.
Welcome everyone. Happy Friday. I hope we find everybody in a good place. I'm outside taking advantage of this beautiful weather. We are literally on our second to last mastermind meeting of the Public Health Preparedness Fellowship. And I am so excited to pass it immediately over to first you all to tell Amanda who you are. And then to Amanda, who's going to tell us about herself. Amanda, you were requested to be here as a person that this group was interested in connecting and networking with. And part of that reason is, one, because you're amazing and a leader in public health in general, but also as a dentist, and because you've literally been responding to COVID-19 for the past year, both in a direct incident management capacity with Ashen Allegheny and Watauga, but also as a provider who went back into the office to deliver services during a pandemic, and services where you're literally in people's mouths. So, high risk situation.
We are.
You know me, everyone knows me. And can I pass it off to these brilliant humans to tell Amanda who you are?
Vienna, do you want to start since we already met just a little bit?
Okay, that sounds good. I wasn't sure who should go. I'm Vienna. I'm a senior public health major. I'm interning actually with Melissa and Jennifer at Up Healthcare, and I don't know what else I should say.
Where are you from, Vienna? Are you from North Carolina?
Yes. Actually, I was born in Anchorage, Alaska, but I've mostly lived in Alaska, North Carolina, my whole life.
Okay. Molly, you're next on my screen. You want to go next?
Yeah, hi. Thank you for coming today. My name is Molly Fox, and I am also a senior public health major, and I'm from Cedar Rapids, Iowa.
Great.
Emily, you're next on my screen.
Hi, I am Emily. I am a junior public health major, and I'm from Cary, North Carolina.
I lived in Garner for many years, so I'm very familiar with Cary.
Very cool.
Jenna, you're next.
Hi, I'm Jenna. I am a public health major. I'm a senior, and I'm actually interning with Vienna as well at App Healthcare. And I'm from Raleigh, North Carolina.
Okay. And Laura, I know you and I have been corresponding via text several times. I'm glad to put a face with that, but go ahead and introduce yourself.
Hi. So I'm Laura, of course. I text her all the time when I'm having my meltdowns, like, oh my gosh. But anyways, I'm from Weldon, North Carolina, and a junior public health major with a chemistry minor. So.
Okay. Well, I'm so glad to see all of your faces today. My name is Amanda Stroud. I'm originally from Happy Valley, which is in Caldwell County, right after you go toward Lenore and pass by all of the lovely views. But I lived in Garner for about 21 years, and my family was ecstatic when I decided I was going to move back here to take a job doing federally qualified health center work. And I'm so lucky to be working with App Healthcare as our local health department and a federally qualified health center. It means that I take on a lot of stuff that's not necessarily within the direct realm of dentistry. A lot of dentists are open a tooth, put a filling in a tooth, see you later. And I'm not that kind of dentist. I appreciate the fact that there are that kind of dentists in the world, but I also love the fact that I'm not that type. I've got my hands on a lot of different things. And being a part of a public health leadership team, like Jennifer alluded to earlier, means that you do have your hands in a lot of pots. And I feel so fortunate that that's where I stand. So I wanted to share a PowerPoint that I had made for you all, and I had intended to share it last time. So I'm so sorry that I had so many issues, but we saw a Spectrum truck come into our neighborhood, and it was about 3 minutes later when we were out. So thank you for your patience, and I'm so excited that you all have invited me back. So I'm going to attempt to present to you all, and let me pull this up. And here we go. Can you all see that screen? Excellent, excellent. So I wanted to talk to you a little bit. Yes, I am chair side a lot. I am doing injections for numbing, taking out cavities, talking a lot about oral health and how to maintain your best oral health care. But there's also a lot of dentistry that can be done outside the oral cavity. And the realm of public health allows you to do that. So yes, I'm a dentist, but I spend a lot of time working outside of the oral cavity. So let's see if I know how to advance this. Did that advance for y'all? Thank you, Jennifer. I just want to share with you all one of the quotes that I tend to live by, and this quote is posted in multiple places in my office as well. It's a quote from John Wesley, and it says, "Do all the good you can by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as you ever can." And I really, truly believe in this quote. I think anybody that has a heart for public health, even if they've never laid eyes on this quote before, still truly lives by this quote, because it's what you want to do. And sometimes things that you want to do are within your realm, sometimes they're not. But this is one of my favorite quotes, and I wanted to share it with you all. We do a lot of patient care in the chair, but part of that patient care is not just fillings. Sometimes it's talking about mental health for our patient. Patients come in and talk about the fact that they are having a difficult day. Sometimes it's just as simple as that. Sometimes we have patients come in who want to talk for 20 or 30 minutes because they're lonely and this is their big outing. They might be in their 70s or 80s and be living alone and don't get a lot of visitors. So this is their outing. But Howie Mandel says if we take care of our mental health like our dental health, we'll be okay. So I wanted to include that in there because sometimes we are mental health providers. We've had patients come in and talk about spouses that have committed suicide, leaving them with children behind, and how difficult that is. People coming in talking about losing their parents who were their sole caregiver, and things like that crop up. And so it's all part of caring for one patient. It's part of dental health, yes, but it's part of our public health response too. So these are some issues that we see that can manifest themselves in the oral cavity. Depression, we were just talking about, increases your inflammatory process. So if you're going through a depressive issue, then a lot of times in the chair, we'll see extra bleeding gums, we'll see sensitivity, we'll see inflammation in general areas, and we'll also sometimes see an increased blood pressure because of that inflammation. Low self-esteem can be linked to diseased or missing teeth and the lack of job opportunities that then manifest because people go in and don't want to smile for a job interview. They're less likely to get a job as a result of that interview. Poor diet, we see a lot. Poor nutrition leading to a high carb intake diet. If you think about it, carbohydrates are one of those things that are really typically easy to eat. It's a lot easier to eat a donut than it is an apple. And when you're losing your teeth because you have dental pain or lack of function, you tend to go for those soft diets. Substance abuse, we see manifesting in dentistry as an issue with pain and pain receptors. Sometimes those pain receptors are blocked. People don't get numb as easily in the dental chair. And then stress, which is something that I'm sure that as college students, you all are not familiar with whatsoever, especially in the age of COVID. But it can result in tooth damage, fracture, pulpal inflammation, where you really have issues, including extra issues with decay because you have a dry mouth from some of those medications that people take to help handle stress. So I wanted you all to be aware of that. These are some instances that have happened in our office in the past few years. In the past few months, that we've had a patient with a husband's suicide, leaving behind 3 children at Christmas time, a special needs adult living alone with only his dog after his mother died, and was worried about his dog changing behavior and he would be all alone. And then a 13-year-old girl with a history of oral sexual abuse by a male in her family member, who then becomes very scared to receive dental care in the chair. So these are all part of what we deal with every day, but they're also part of a public health response. I know 2 of you are interning at App Healthcare doing various things, but part of these are part of our public health outreach for mental health, for behavioral health, for any sort of outreach like that. We also reach out for patient care in the womb. It's really important to get good maternal patient care during that perinatal phase in a woman's life. And as people are pregnant and having issues with teeth, getting those treated so that they do not extend past the birth of the baby when a mother's focus wants to turn to just her child. Because we all know that as children are born, they need their mothers dramatically, and you start to care more for your child than you do for your own self. It's just what happens in the way of life. So we actually have a couple of programs that reach out to some of our women, infants, and children's programs, or our WIC program. And so that's a part of what goes on as well. Oral care for mothers helps provide a better pregnancy experience, helps keep a mother healthier, but also maintains that health and creates that educational component for a mom to be able to pass on the educational component to the baby. I don't know if you all are aware, but the bacteria that cause tooth decay are actually not harmful to a child until they erupt their teeth, because they don't attach to the tooth. The Streptococcus bacteria attach only to tooth structure. So it typically gets passed by kissing a child or by a child eating after someone in the family using the same utensils. Medicaid does provide coverage for dental health benefits for people who qualify, who maybe wouldn't normally qualify for Medicaid, but do qualify during a pregnancy. So there is that. But the medical side of that benefit actually ceases about 8 to 12 weeks after delivery of the baby. The dental component ceases at the point in time of delivery. So any mother's medical treatment has got to be done during a pregnancy if they need to get work done. There are hormonal shifts during pregnancy that we all have to watch out for. It leads to a higher rate of oral bacteria, but it also can lead to a tumor-like effect in the mouth called a pyogenic granuloma, and that's commonly referred to as a pregnancy tumor. A lot of people will get those and have those, and it's just based upon the hormonal shifts in a woman's body. And then there's obviously excess acid development and excess acid that comes in contact with tooth structure as people go through morning sickness issues. Hey, Ella. Hey, Anna. I don't know if she can hear us, but that acid touching the tooth structure deteriorates that tooth structure and can cause excess decay. So as we're talking about women, infants, and children, I see a power woman in Jennifer Schrader Tyson. I see one Jenny and one Etta, and so it's great timing to see her with her children. Patient care, we also reach out to do patient care even in the digestive tract. Part of what you eat, who you are is what you eat is what you become. I was talking about the Women, Infants, and Children's program, but we also reach out with type 2 diabetes programs that we have through the health department as part of our public health response. High school club opportunities as well, including college club opportunities with some of the interest clubs. And then we also do blood pressure screening programs. We check a blood pressure for all of our patients at least once during their visit, and oftentimes 2 or 3 times, especially if they're doing a more traumatic visit like an extraction or they're undergoing nitrous oxide. You guys can stop me at any time if I just keep on rolling through, but this is one of my favorite slides.
This is so great. I love how you set this up. Keep going.
Thank you. Thank you. Patient care in the digestive tract continues. One of the things that I started when I came to work here at App Healthcare, and people were so gracious towards me, is I started doing a garden on the hillside around our dental clinic and giving away that produce as it became available to our patients in the lobby. That actually grew. And now we have transferred our hillside garden to an actual physical garden space at Gentry Farms. We've partnered with them. It's an all organic farming opportunity. And we are still harvesting produce out of that garden. We're in the planting stages now for this year's garden. So if any of you are available over the summer and want some volunteer opportunity and want to be able to talk about giving back to the community, this is huge. So we pair this up with our WIC program, our Women, Infants, and Children's program. We have paired up also this year with our type 2 diabetes outreach programs and our migrant farm health program. So these are actually, this is my son in the middle, actually eating one of the beans that we grew in the garden, but we grew this.
He's getting so big.
Yes,
what
he really
the heck?
And you'll see some of my staff, all of our staff have volunteered in the garden, and then you'll see some of the women who have given us permission to share their images, picking up produce and their dental goodie bags, and that's me working in the garden. But this past year, we planted zucchini, yellow squash, we planted beans, we planted potatoes, and we planted cucumbers. This upcoming year, we're extending that to corn, some lettuces, and some winter squash, butternut squash, in addition to what we've already planted, and onions, so that we can do a lot more outreach. We also this year, because of the success of our garden, we've been able to team up with one of the North Carolina agricultural extension agents who's going to work with us. And then we've written this into our migrant farm worker health grant as well. A lot of our migrant farm worker people who are here visiting short term are here living in housing standards that would be a lot of times considered to be substandard, but they're also subsisting off the dollar menu at McDonald's or Wendy's or wherever. So being able to reach out and provide them fresh organic produce that goes along with their way of life is really key. So, any questions so far? I'm going to continue to roll through. I'm still so excited you all let me come back because I was so disappointed last week.
I love how your pictures are so current, you know, like what is it like to continue to do this kind of work during the pandemic?
Well, it's funny that you should say that because this very next slide shows me doing a talk about our pandemic work for our migrant farm workers. Our dental has not changed tremendously. We have had some changes because in dentistry, we've always created a lot of aerosols. And when we found out that this would be an aerosolized virus that we were having to combat, dentistry was looked upon as one of the forerunners in, hey, what can we do? Who has what that we can use? Well, our dental program pretty much already had everything that anybody needed to use. We already had N95s in the office. We already had level 2 and level 3 face masks. We already had face shields and goggles. We already had gowns, because those are all things, and of course gloves, but those are all things that we use every day in dentistry because we create aerosols every day. So, and in very, very high volumes. So being able to reach out, this is me actually doing a safety and self-care webinar for the North Carolina Cooperative Extension and the Christmas tree growers, for our migrant farm owners, owners of those local Christmas tree farms who utilize migrant farm workers throughout the year, so that they could set up. And right after this, we actually did delivery of a lot of supplies that we'd gotten in, but also a lot of supplies that went from the dental office out that we had already stocked, because we use things so often and in so many programs that when our dental office closed, because we had to combat COVID and answer the public health call, we were able to reroute a lot of that supply that we already had in our office, including even sanitation items, cavicide wipes, those high efficiency, highly effective wipes that are antivirus and antibacterial, bactericidal, things like that. And a lot of the sprays that we use, and even Clorox we use, so chlorine bleach that we use in some dental items to just do cleaning procedures. We had all that in stock, and that was the stuff that people were looking for and treated like gold. So we were happy to answer that sort of response as well. But these are the types of outreach things that I was talking about earlier that for me is such a vital part of what we do in public health dentistry and dentistry, but they're not chairside, drill to tooth types of items always. So I think it's really exciting. This is actually talking about patient care in the workplace. Of course, during the pandemic, everybody went virtual, right? Including this virtual class that we're seeing now. And so with that virtual opportunity, presented an opportunity for virtual dentistry. Now, you can't do virtual dentistry to do the physicality part of dentistry, but this part is patient care, where this patient at the top that you see pulling his lips down has had such an irritation that he's become super inflamed around these teeth with all this bacteria and all this buildup, and went through the process to have these teeth removed. You'll see that first canine, so that second tooth, if you're coming in from the left-hand side, has such bulbous gum tissue around it that's so red and so swollen, and each tooth ended up being like that. You'll see in the long picture that is the right-hand border, this gentleman has a partial denture that is not fitting snugly with the tooth behind it. It's raised, which is circled there. And because it's raised, it's interfering with his bite. So these are all things that we could diagnose and make a plan for treatment just by way of looking at photos and getting virtual images. On the lower left-hand corner, you'll see a picture of a radiograph. Now, a radiograph has to be done in person, but it does not take anyone going to dental school to look at this and saying one tooth is angled and it's creating a big giant hole in the tooth in front of it that it's touching. And that hole actually goes into the nerve structure of the tooth. This patient's complaining of pain and swelling, but virtually I could send one person out instead of inviting this person to our office to meet with 10, 12, or 15 people. I could send one person out to take this image and get this image and get back to the office. So it created in dentistry a niche of teledentistry that had been up and coming, but had not yet been succinctly planned in any way, shape, or form. But it allowed us to push through a lot of policy that said, yes, this is acceptable. and that it meets the standard of care that you would have, same standard of care you would have in person. You can get images like this and determine if you need to give an antibiotic to a patient prior to doing treatment, or if you can schedule a treatment, and if so, about how long will it take. So you're eliminating that first visit where it's just a look and see and plan type of visit. But it also allowed us to push forward policy that says that there will be reimbursement rates for dentistry that's like this, where you're not seeing a patient in person, but you're still being as effective as if you were seeing a patient in person. And all of those policy things link all the way back to public health, because that now means that for me, I could actually give care to more people by sending staff out and reviewing images as they come in, as opposed to me having to physically put hands in mouths, glove up, deglove, sanitize, change masks, change all of your personal protective equipment like your gown, your glasses, your goggles, your face shield, and then go to the next person. So not only is it preserving PPE, which is at a very, very rare state right now, even now, the national stockpiles are still pretty much at zero based on what they have been in the past for a lot of things. But this allows us to preserve PPE, to still treat a patient, and to better organize and manage our time and our resources and materials. So this is a huge change in public health dentistry, but it's a big push for public health and a big step forward for public health in general. Going too fast? You guys still with me? Okay.
No, but I want them to know about your history too. So I don't know if you built that into this presentation.
So getting ready to talk about, I think what you want me to talk about. So growing up in Caldwell County, I am the proud daughter of a bunch of factory workers. My parents are divorced and they're both remarried. My mom got remarried when I was 4. My dad got remarried when I was 17. But my parents, needless to say, did not have a lot of excess finances. They did not have a lot of extra money. I'm the oldest of 7 children. As the oldest, you become a second mother. The first time I saw a dentist was actually in school. It was a public health dentist who came to my school and sent home a note that said, your daughter has cavities, they need to be taken care of. Now, if you look on your screen, I am now that public health dentist. So I visit the schools in all 3 of our counties. We visit every school, elementary, any middle schools, because not all of our counties have them, and all of our high schools as well. We open up our services to every patient who's interested, every parent who's interested for their child to get services. We have a portable set of equipment, and now we're up to 6 portable chairs that we take into our schools. These are some of our school setups. As a matter of fact, the patient all the way on the right-hand side is my son at his daycare in that chair, getting his teeth worked on. So we are so thrilled to be able to do this. We have not been able to do it the past year due to COVID. I'm sure you all are tired of hearing that. But the year prior, we saw 800 children in schools who might not have seen a dental provider otherwise, to be able to provide preventive services. So their cleaning, their exam, their fluoride, their x-rays, all of that provided. Also be able to provide sealants to help protect teeth against progressing cavities or against developing cavities in the future. And in some instances, we were also able to provide dental care to patients. So if they had a broken tooth or a cavity that a parent could not get them to the office, we were able to do that. In the past, public health dentistry is not a huge ball game as far as the players are concerned. There are not a lot of us. And so in the past, to do this, we've been able to close our office and rearrange our appointments at our fixed site. We have now grown to have 3 dentists and 1 part-time pediatric dentist on staff. And so being able to do programs like this are so important for the success and the health of the community. I always say that I don't know if one of the kids that I've treated is going to be my daughter's future husband or my son's future wife. I don't know if these are going to be my daughter-in-law or my son-in-law. I don't know if they're going to be related to the people that become part of my family in the future, but I treat every one of them like they are, because this is how I started. And everybody should have the exact same access to care. It should be accessible and equitable for everybody. And so we are literally taking dentistry to where it is needed for all the people that it's needed for. So Jen, I don't know if that's what
Well,
you were alluding to.
yeah, definitely. And, like it's one thing to say, hey, CEO, there's a need for people in rural communities to have access to great dentistry. And then there's the actual how that plays out. It takes an Dr. Amanda Stroud to convince those people. I guess that's the side I've seen you perform so well, to say, because dentists can get paid between $150,000 to $200,000 per year. How do you fund a program like that and get all the staff while also only charging people a nominal fee? And by nominal fee, I literally mean no more than $25 bills, or like, after, I'm going to stop because I'm going to start saying things that I don't understand about dentistry, but how you make that argument, I think that's what you're really freaking good at. And I don't know if you wanted to touch on that a little bit.
Sure, I will. And we're talking about patient care in schools. We go to all of these schools, and what we actually talk about is those 800 kids who might not otherwise have received dental care. And of those 800 kids, how many are we maybe preventing a cavity for? Because that is worth its weight in gold. But what Jennifer is talking about is the fact that my budget is over $1 million every year. And of that, roughly $1 million, about $700,000 of that is salary. So if we do not do our work and do a good balance of our work to reach out to everyone, and if we do not chase every funding source and be smart about what we're offering and how we offer it, and be very succinct in our visits and what we're providing, then we have to close the doors, and that doesn't help anyone. So not only are we very much gung-ho about doing what we do because we love it, we wouldn't do it if we didn't love it, but we're also very gung-ho about, hey, not necessarily look at us as a dental program that says, hey, we're providing great dentistry, but look at us as a dental program that says, hey, we're providing great dentistry in your community for your neighbors, and we're also doing other services that are linked to that, because all of those services together are making your neighborhood and your community a healthier place. And when we talk to people who are county commissioners, or when we talk to people who are the town manager or the county planner, we're talking about how we affect their communities directly, because they're part of our funding too. They're part of our funding source. They want to know where their funds are going and how they're being applied through the dental team and the dental program.
So, like I mentioned before, we've had so many great opportunities in this fellowship to do new things and collaborate and gain these real world skills and apply them. And part of this application has been speaking at conferences. And this past week, I was speaking at a conference with Jennifer and one of my co-fellows, Emily, and my internet connection was in and out and in and out and in and out. And I absolutely will never forget being at a conference with big names and just the feeling of, oh my gosh, I might not be able to speak, my internet might cut out. I'm thankful for it because it's a good learning experience, that not everything goes as planned, but definitely that is a good memory. I would also say just another thing that I will remember forever has been the great group of people that I've been able to work with. I have learned so much, and I will always remember the conversations that we've had and the advice that I've received, and just kind of the great things I've learned from every single person that is a part of this fellowship. So all of it is memorable. Some of it is good, like getting to meet amazing people, and some of it is bad, like my internet going out at a national conference, but I wouldn't trade it for the world.
The most memorable thing that has happened in this fellowship is when we had our very first meeting over Google Meet, and I could not find the end button to the call over Google Meet. We had originally just been using Zoom, and this was our first time using Google Meet. And it was just Jennifer and I left in the meeting, and we were just sitting there laughing and staring at each other for what felt like a minute or longer, until eventually I found the button that ended the meeting. So I will never again get locked and trapped in a Google Meet meeting, because now I know where the end button is.
So the most memorable thing would be being part of the inaugural cohort in the middle of a pandemic.